Good day, everyone. Uh, we are Mariam Youssef and Kofi Budunu, and today we are addressing the question: how can African countries tackle the potential economic disparities created by access to genetic and genomic technologies? As the negative theme, we are advocating for the private sector involvement as the best approach to addressing these disparities. While public funding initiatives offer certain advantages, we firmly believe that incentivizing the private sector drives innovation, ensures efficiency, and creates sustainable solutions to these challenges. In this presentation, we will demonstrate why private sector engagement is key to unlocking the full potential of genetic and genomic technologies for Africa's future. So, genetic and genomic technologies have the potential to transform healthcare across the globe. However, for many, especially in African countries, these technologies remain inaccessible due to significant economic disparities. This creates a critical challenge. How can African countries balance fostering innovation with ensuring equitable access to these life changing advancements? As the negative theme, we firmly believe that the private sector involvement is the best solution to address these disparities through innovation, investment, and efficiency. The private sector can drive progress while creating sustainable solutions that benefit all. Throughout this presentation, we will demonstrate why this approach is the most effective path forward. The private sector brings unique advantages to the table, advantages that even the governments simply cannot achieve alone. These include innovation, access to significant funding, and the ability to scale solutions effectively. By incentivizing private companies, African countries can 1. Drive technological advancements, ensuring cutting edge solutions are developed and implemented. Second, attract critical investments that are essential for sustaining growth and innovation. Third, scale access rapidly and sustainably, ensuring these life saving technologies reach those who need them the most. So now it's clear that public resources alone are not sufficient to meet the growing healthcare demands of African population. Partnering with the private sector is not just an option, it's a necessity for addressing these challenges efficiently and equitably. So, argument number one is innovation and expertise. The private sector stands as a global leader in cutting edge technologies and research expertise, especially in the field of genetics and genomics. One key advantage is competition. Companies continuously strive to outpace each other, driving innovation and over time lowering costs to make technologies more accessible. Consider leading companies like Illumina and Novartis. Illumina has revolutionized genomic sequencing by making it faster, more precise, and significantly cheaper. Novartis has pioneered advanced treatments in precision medicine, transforming the landscape of personalized healthcare. Additionally, the private sector excels in efficient service delivery models. These models are designed to reduce operational costs while simultaneously improving access, ensuring that more people can benefit from these innovations. Ultimately, it's the unique combination of expertise, competition, and efficiency that makes the private sector a driving force in addressing economic disparities in healthcare. Um, Argument number two, attracting investments. Incentivizing private sector involvement is a proven strategy for attracting both domestic and international funding into the genetic and genomic fields. By offering incentives such as tax breaks, grants, and strategic partnerships, African countries can create an environment that encourages investment from global biotech leaders and innovators. This approach significantly reduces the financial burden on governments, freeing up resources to be directed toward other critical areas like education, infrastructure, and public health. A compelling example of this strategy in action is public private collaboration in countries like Nigeria. These initiatives have successfully drawn international biotech funding, bringing cutting edge technologies into local healthcare system. By prioritizing private sector engagement, African nations can unlock a wealth of financial and technological resources, ensuring that progress in genetic and genomic technologies benefits everyone. Okay, so for argument number three, job creation and economic growth, let's now focus on the significant economic benefits of the private sector involvement in biotechnology. By supporting the growth of the biotech sector, we see a direct impact on job creation, particularly in biotech, healthcare, and the various industries that support them, such as research and development, manufacturing, and distribution. Private sector investments help stimulate this job creation by fostering innovation and growth within the biotech industry. As biotech companies grow, they generate employment opportunities for skilled professionals, including scientists, lab techs, and regulatory experts, as well as support roles in logistics and administration. Moreover, this sector acts as a catalyst for economic diversification. By nourishing a robust biotech industry, countries can reduce their reliance on traditional industries and create a more balanced and sustainable economy. A great example of this is Kenya's rapidly growing biotech sector. Over the past decade, Kenya has seen a surge in biotech related investments, leading to a creation of high quality jobs and attracting international investors. This case underscores how private sector involvement not only generates direct employment but also fosters a more resilient and diversified economy. Next, let's explore the role of public private partnerships or PPPs in ensuring both effective and equitable healthcare solutions. PPPs combine the strengths of both the public and private sectors. Public oversight ensures that access to healthcare remains fair and spread, while private sector efficiency drives innovation, speed, and cost effectiveness. There are various successful PPP models that make healthcare more accessible to all. One such model is providing subsidized services for low income groups, ensuring that even the most vulnerable populations can access essential treatments. Another approach is tiered pricing strategies, which allow private companies to offer treatments at different price points, making healthcare more affordable based on a person's financial capacity. A real world example of a successful PPP was the global vaccine distribution during the COVID 19 pandemic. Governments collaborated with pharmaceutical companies to develop and distribute vaccines quickly, efficiently, and equitably. Through these partnerships, vaccines reached millions of people worldwide, regardless of their income or geographical location. This highlights the potential of PPPs to not only enhance efficiency, but also ensure that healthcare remains inclusive, demonstrating their vital role in both public health and economic growth. Moving on to scalability and reach, one of the key advantages of private sector involvement is its ability to rapidly scale up services, particularly in areas such as genomics, healthcare, and diagnostics. Private companies have the flexibility and resources to expand quickly, ensuring that even undeserved populations gain access to essential services. Public systems, on the other hand, often face limitations in terms of capacity and resources, making it difficult for them to expand at the pace required to meet growing demand. This is where the private sector plays a crucial role, complementing and supplementing public efforts. A great example of this scalability is seen with private telemedicine companies in Africa. These companies have successfully expanded access to healthcare in remote and rural areas, where traditional healthcare infrastructure is often lacking. By leveraging technology and mobile platforms, they can reach communities that might otherwise be overlooked, providing consultations, diagnostics, and even treatment remotely. This ability to scale rapidly and reach wider populations highlight the potential of private companies to fill critical gaps in healthcare delivery, especially in regions that need it the most. As a closing statement, African countries can't afford to rely solely on public funding for genomic technologies. To bridge the gap, incentivizing the private sector is crucial. It brings innovation, funding, and efficiency to address existing disparities in healthcare access and delivery. With proper oversight and strategic public private partnerships, the private sector can complement public efforts, ultimately building a sustainable and equitable healthcare future. By embracing this collaborative approach, we can pave the way for a healthier, more prosperous Africa. Thank you. Thank you so much for your attention. Now we would like to open the floor for any questions or comments you may have. Please feel free to ask about any of the points discussed today, or if there is anything you would like me to clarify further. Thank you.